cover the gaps in our social safety net, which is great here, and helping our homeless population. If we're in our seniors, as we have an increasing senior population, we have to grow our economy to do that. And I think we have the infrastructure and the bones and the ingenuity and the entrepreneurs here to do it, but it's just going to take an increased focus from the council. So I hope to work with my colleagues on that in particular.
Okay, sounds like a great plan. Thank you so much for taking time to be with us today.
Good to be here. Thanks for having me.
I'm pleased to welcome everyone to this Greater Washington Regional meeting of our Commission to Study Mental and Behavioral Health in Maryland. I want to thank our host, Montgomery College, for having us this evening, providing the space for us to do this and to talk about this critically important issue. As I've said before, the subject of this commission that we'll be discussing and continuing to discuss over the next several months and actually years, it's not always an easy topic to discuss, but this represents something that I should say an opportunity for us to make a real difference in people's lives and to truly change and reform the way we deliver services to some of our most vulnerable citizens. I like to say it's far past due that we take a serious look at how we deliver mental health services. As I say, when I say how we deliver, I also include the federal system as well, not just our state. And it's something that I feel very strongly about and an issue that is close to my heart. Over the last 4 or 5 years, 4.5 years since the governor and I have been in office, we've been working to address the state's opioid issue. And I'd say I came to understand, many of you probably already understand the relationship between the disease of addiction and mental illness. Previously, I looked at these conditions as separate and distinct. And I've learned, and as many of you already know, that substance use disorder and mental illness are often co-occurring. And for some people, it may have been a situation where people were self-medicating, where they had undiagnosed mental illness. And so we want to make sure that we address these issues because they do not just affect the individual who is suffering, but also the families and their communities as well as their friends, I should say, too. So we want to take a fresh and serious look at how the state and the country, for that matter, bring care to individuals and families. And to that end, the administration created this commission, and the governor asked me to chair it. It was through an executive order earlier this year. And our goal is to identify ways to improve the services that affect many Marylanders that are suffering from mental illness and co-occurring conditions. And we're doing that by engaging families, advocates, practitioners, and those on the front lines of this issue.
I want to thank you for doing this, and I think this is a very important commission. I'll say I wish you had the abilities of the Kirwan Commission, because Kirwan's dealing with two sides of this problem, which is, A, what are the programs we need to move our children forward, and how are we going to pay for it? And the part that we need to confront, because I think we all know pretty much what we need to do. I think you all map out a reasonable way forward, and then the question is going to be, how do we pay for the reasonable way forward? And I would suggest that dealing with mental and behavioral health issues is as important as dealing with education issues. We're dealing with education issues because we lose these students in the beginning. We're losing people on the other end to behavioral and mental health issues. And both of them result in us not being able to take full advantage of the human resources that are available in our communities. When we lose people who can't do productive things, we lose the opportunity to take advantage of the skills and the intelligence they could bring to things, and we don't do it. So I hope that in the long run, we really get to tackle the financial challenges that it takes to really fund some of the things that we all know we could and should be able to do. I'll just tell you a little bit of some of the fun things I've been dealing with, because I've seen this issue front and center this week multiple times and over recent weeks. I've talked with groups of high school students who talk about levels of depression and stress that I've never seen, and most people have never seen. I was regaled with stories of students who had breakdowns in school, were taken out of school by ambulances, and got to spend days in the hospital getting mental health support. And I went to school in Montgomery County, and that was not the kind of stories that people told about what was going on inside the high schools. And these kids, to a person, went around the room and talked about stress and the impact on their lives in school. And that's, I think, important that, we know we don't have the counselors and psychologists in the schools that we need to have in the schools. I was meeting with the community in Montgomery County the other day, and they were talking about the growing number of homeless and the problems they were presenting in the community, and more prominent behaviors, more behaviors that were disturbing, and talking about the impacts on the businesses and the residents that they were trying to attract there. But what I took as encouraging is they did not want me to arrest people. A lot of times, and in other days, that would have been the conversation: can you put these people away? And instead, they said, you've got to find a way to treat these people. They need help, and we need the resources to be able to help them. And we need programs to be able to help them. I operate one of the largest mental health facilities probably in the state. Not the largest, because I think you have a bigger one.
Second to our state
But
penitentiaries.
But ours, 1/3 of the people in our jail present with mental health issues. They really don't belong in jail. And if they got the treatment, if we were able to support them in mental health issues, they wouldn't be in jail. And the resources that we spend to put people in jail is enormous. And you got to wonder, if we took those same resources and put them in mental health, what would we get? And the same thing is true with homelessness. When I arrest somebody for not complying with not appearing in court and they get a bench warrant, what I'm going to spend to put somebody in jail overnight or for 2 or 3 days is probably equal to what I could have put them in a good hotel in Montgomery County for a month. And they're going to go back and through this. We need more support for police crisis teams. We talk a lot about, more and more our police go out in the field. They encounter people who present mental health issues. They don't have the resources to deal with them. We don't have enough crisis teams to get there or get there in time, because what we have has to be in the right place and the right time to arrive there before an officer winds up doing something they would probably rather not do. And these are real life and death decisions to get made, simply because in some cases we weren't able to get the right resources to that place at the right time. So these are all real things that we deal with. And the last thing I'll talk about is, knowing people in the mental health who deal with folks who present both disabilities but also mental health issues. And some of them receive services, but if their allocation for services runs out because they've spent what the agency can spend in dollars on getting a person in front of a psychiatrist or whatever the help they get, they will go for a period of time